But experts say the virus is here to stay. We're going to continue to see periods of lower transmission, as some counties you saw there on the map we're seeing, but also higher transmission. So that means testing will remain an important tool. So are the at-home rapid tests we've come to rely on accurate enough? WCNC Charlotte's Chloe Leschner is at Novant Health with those answers.
COVID tests are really just a snapshot in time. Experts say the type of test you use and when you use it can determine the results and if it's accurate. At-home rapid antigen tests have been a game changer in the pandemic. There's no need to wait in a long line or days for results. We can swab our own noses and find out in minutes if we're positive or negative. But can we always count on those results?
The truth is that no test is perfect.
There are two main types of tests used in the pandemic, PCR and antigen. Research published by the Journal of the American Medical Association suggests rapid antigen tests give many false negative results. In a study of Stanford athletes, only 63% of positive cases were caught on antigen tests, but the accuracy varied significantly depending on whether or not the person testing was symptomatic.
The antigen tests basically aren't quite as sensitive, which means it takes more viral particles, more viral material, to trigger a positive test.
Dr. Charles Berger, Novant Health's medical director, says the amount of virus a person is shedding can change as their body reacts. That's why test results can change from day to day. PCR tests, which have been the standard through much of the pandemic, are much more sensitive and don't need as much viral material to correctly produce a positive test.
And if you're still concerned because you're having a significant fever, you're having significant cough, and you have another negative test, maybe it's a good idea to go somewhere and get a PCR test done just to be safe.
But you can still count on the at-home tests. Research shows antigen tests are less likely to give a false positive result.
Nothing's absolute, but generally speaking, if it's a positive antigen test, that usually turns out to be true. Where we know the antigen tests struggle are in their sensitivity. So if you test negative, there's a potential that you could still have SARS-CoV-2 infection.
Doctors say the varying dependability of tests points to why they're just one tool in the arsenal of ways to prevent and slow the spread of COVID. At Novant Health, Chloe Leschner, WCNC Charlotte.